So my name is Lis Krimble, and I'm a volunteer with Transplants for Children. I'm excited to introduce to you our panelists today. National Pediatric Transplant Week takes place the week of April 19th through the 25th. And so I want to recognize the work of Donate Life America and the United Network for Organ Sharing Alliance and the work at Transplants for Children, who all are committed to sharing the stories of patients and donors and advocates whose lives have been impacted by organ donation. So I want to just open up with the fact that there are over 1,900 children under the age of 18 currently on the transplant list. And more than 600 of those children are aged 1 to 5. So the work that we do through Transplants for Children is very important and touches the lives of so many. So specifically, let's introduce our panelists tonight whose lives have been impacted by transplantation. First of all, we've got, I'd like to introduce Rosy Valdez Garcia. And she is a transplant advocate who's going to tell you about her story. We also have Debbie Frazier, who is a living donor. And we have Dawn Martin with us, and she is the mom of a transplant recipient. And we have Darnell Wan, who has, Darnell, what should I say? Touched every aspect of organ donation through work and personal experience. So thank you all for joining us tonight. And Rosy, could we go ahead and start with you?
Sure. Hi, my name is Rosy. My sister was a donor. A year before she passed on, she asked me, "Hey sister, are you an organ donor?" And I said, "Well, yeah, you know, somebody's gonna use my organs if needed." So she went ahead and signed up. And a year later is when she became a hero and donated her organs. My sister was the age of 32, got sick, and we were told there was nothing they could do for her anymore. So going back, one of my aunts needed a kidney and a liver transplant and passed away on the list. And one of my cousin's mother-in-law needs a kidney transplant. So we thought, you know, I told my mom, "Hey mom, you know, what if we donate Regina's organs?" You know, not knowing if my sister had really signed up or not. And my mom, without hesitation, said, "Let's do it. Let's figure out what we need to do." So we went to the nurse's station and we asked, and the nurse said, "It's been taken care of. She's already registered for the national registry that she's an organ donor." And I thought at that moment, wow, like it's gonna happen. Of course, we don't know all the aspects of it and what happens and how long it takes and whatnot. But in the midst of having her being gone, it helped us heal faster because she saved lives. My sister was a pre-K teacher. She donated to adults. She didn't get to donate to a child, but her love for children was amazing. It was all about her kids. It was all about my kids and kids. So we found Texas, the Children's Foundation, and we've given back these past 2 years that my sister's been gone. This year we gave back teddy bears in her memory, so that the children don't feel like they're alone. And my children went to a bereavement center, and this is what the message was: you receive a teddy bear and you hug it, and you're never ever alone, and you always have somebody to talk to, no matter who it is. So I feel that my sister is working through us to continue her legacy of being a hero. You know, I'm very proud of her. And we've just been really blessed to have this family of, you know, TFC, and along with the TOSA, you know, very good family that have welcomed us. And we've learned so much about organ donation, and I think that it's something amazing. It has impacted my children. My 8-year-old says, "Mom, the day comes where I pass away, you give somebody my organs because some of those kids need it." So coming from my 8-year-old, I think it's impacted him and my kids a lot. It's impacted my parents. They both are now organ donors. My siblings and family members have all registered. So I think becoming an organ donor, yes, there's a lot of yes and no's and misunderstanding, miscommunication, miseducation, or to the it sounds kind of sometimes reality when you hear that these recipients are living, it's so that's my of of being a donor family.
Thank you so much. And I know we have talked with some of the kids that have received the bears, and they just love them. So can you hold that guy up one more time? That's great. Thank you so much. Debbie, could we switch over to you and talk about, again, that idea?
I put
Debbie, could we switch over to you, and would you be willing to share with us a little bit about being a living donor?
Absolutely. My sister became ill, and she kind of slowly progressed as far as her kidney function went down fairly slowly and then rapidly. So we knew probably a year before the actual transplant that she was getting closer to the possibility of needing one. In February of 2018, she was down to 14% usage. So at that time, she sent my brothers and I a message and asked if we would be interested. And my husband and I had already discussed it quite a bit. So of course we sent a text back immediately and said, yes, I'll do it. We started the process in mid-March of 2018. And the first week of April, we were given the option of two.
I think we may have frozen up real quickly. So while we're waiting to see if we can kind of get that caught up, John, could we switch over and talk to you a little bit?
Sure.
We're gonna just do a little technology fix.
Okay, no problem. No problem. So Travis was born in October of 1992. We did not have the internet then. We had no immediate way to look for information. He was actually born healthy. He had good APGAR scores, and he was 2 months old at his 2-month well baby check when the pediatrician found his defect. So we literally went to the pediatrician thinking that he was going to have sore legs in the afternoon, and we were going to go unpack and move into our new apartment. And instead, he was immediately admitted to the hospital. And it was probably about 10 days before we found out that he would need a transplant, or that would even be an option. But they had told us upon diagnosis on that first day that his defect was not fixable. He had an atrioventricular septal defect with a hypoplastic left ventricle. So we spent 3 Christmas in the hospital, and then went home for a day or two, and then basically spent the next 3 months in the hospital. There was a process of getting him on the list, finding out if he was a good candidate to be transplanted. We tried to do as much research as we could to see if this was something that was even viable for him. The oldest child that had had a transplant as an infant at that point was 6 years old. And so we had no idea what his future was going to look like. I actually chased a mom down in the hospital hallway one day who had come back in with her child for his 1-year biopsy to talk to her and her husband about what life was like for them and what life was like for their little boy. And we decided that, yes, this was something that we wanted to do. And then at that point in time, and I don't know what it's like now, our family was evaluated by the social workers to see if we could support life after transplant, the multiple doctor's visits, the medications, all of that sort of thing. And so we had a conference and we brought everybody who loved Travis into this conference room to meet with doctors and social workers. And I think there were probably about 15 people in the room, aunts, uncles, grandparents, best friends, great grandparents, everybody was there. And so he was listed finally. We had some really bad days that he was taken off the list temporarily due to fevers, respiratory distress, that sort of thing. And then he would go back on the list. And then finally in March 28th of 1993, we got the call. My husband and I had started going on dates on Friday nights, trying to keep some kind of normalcy, keep our marriage healthy. And Travis's grandpa would go spend the night at the hospital with him, and I would spend one night a week at home. The rest of the time I was at the hospital. And we had gone to the circus, and I wore a big button that had Travis's picture on it everywhere I went if I wasn't with him. And we went to the circus, and we got the page. We had the old tiny beeper went off in the middle of the circus, and we went running out of there, got to the hospital about 11 p.m. or it was about 9:30, and about 11 p.m. they took him to surgery. He was in surgery until about 7 a.m. the next morning. We stayed up all night, and he has done great really ever since, until he was in college and he had some trouble with his kidneys. But he's had a remarkable life, and way more than we could have imagined for. So.
And now he's giving back.
And now he is giving back. I could not be prouder. Yeah, no, he's doing amazing.
It's wonderful. Thank you. Debbie, we kind of lost you for a second. So,
Okay.
yeah, so if we could just pop back over to kind of talking about the story from the side of your family.
Okay. I guess just to say we decided pretty quickly, although we had about a year to mull it over, and it, it's your sister, and I love her, and of course wanted to be there for her, but I didn't really think about it much until the night before the surgery, and then I had a little kind of butterflies, and I was a little fearful, but I prayed, and after that I was fine. We went into surgery. I was there at 5:30. I think we went into surgery at 7. I remember being moved at about 2 p.m. down to the I guess my room for the next 15 or 16 hours. I was released the next day at 9:30 a.m. During the evening, I was able to get up and walk without a nurse. I probably walked 3 miles, 4 miles in the hospital. I made sure to take my stepper. And, but after the surgery, I was a nervous wreck. I was worried about my sister. You don't really get to see the results of the surgery or see the person right away. And at 2:30 a.m., I think because I had pestered them so much, they decided to take me down to visit my sister. And that was a huge relief. She was moving around. She was speaking. Her urine levels had returned to pretty much normal, which I thought was amazing. And just the color in her face was she had color, which she hadn't had color for probably a year. So anyway, for me, that was um, that was the biggest relief. I probably cried uncontrollably for about 5 minutes, which I'm not a big crier. So anyway, that made it all worthwhile. Like I said, I was out of the hospital by 9:30 the next morning. I took pain medication until Sunday, so 3 days. I was off of the pain medication. Monday, I started walking 3 to 4 miles. And the only issues I've had have been blood pressure. My blood pressure goes up a little, and well, it gets high at times and then goes very low at times. I had never had any blood pressure issues before that. But again, it's just a matter of recognizing it and going on. I went back to work 3 weeks after the surgery. So I think it was obviously a good thing for my family. All of my family are organ donors now, as far as on their driver's license. I think I do want to be honest and say I experienced a little anger towards my sister. She had a drinking problem before the surgery, and she had stopped drinking in February before the surgery, and she picked it back up after the surgery because she did feel very well, and I think that presented an anger issue with me. But to be honest, I did go to counseling, and I would do it all over again. That's a small thing. I still have my sister with me, and I don't know what else to say.
I think that's a real thing. So thank you for sharing that. That the emotions that are all wrapped up in transplantation, it doesn't end. It's not like at transplant that the issues stop. It changes, right?
That's correct. And the hospital, you go through the social and psychology kind of testing beforehand, and they were very honest about, how do you think you'll feel, and this probably won't go on. She'll probably revert back after the surgery, and I probably wasn't as honest with myself about that, but I again don't think I wouldn't have changed my mind about being a donor at that point. So, or now, I wouldn't change my mind about it at all. So it was just something I've had to deal with and get, and just realize, it was a gift to my sister, and what she chooses to do with that gift is her journey, not mine. So
Thank you for sharing that story with us. Say, Darnell, I thought we'd switch over and talk to you for a little bit. You could talk personally and professionally about organ transplantation.
All right. As Liz said, I'm probably wearing multiple hats today. One hat that I'm not wearing is I'm not a pediatric transplant recipient, but I have worked with transplant recipients in my professional life. And so the hats that I am wearing is I'm a liver transplant recipient. I was transplanted on Halloween Day of 2005. And I had a genetic liver disease, autoimmune disorder called primary sclerosing cholangitis, which is a fairly rare disease, but as a slow-moving disease that it's something that they feel has a genetic predisposition, but as in all autoimmune disorders, it's one of those strange things that's hard to track. I was in the Air Force Nurse Corps for 28 years, and the 20th year of that career, I was stationed at Kunsan Air Base in South Korea. And I started turning yellow, and as you can imagine, being on active duty, we're really a pretty healthy population. And so they worked me up, and they found this disease and sent me back to the United States for really to find out whether I was ready for a transplant. That it was really not in a situation in Korea where I was able to get the level of care that I needed to make those kinds of decisions. So I was back to the United States and was found that I did not need to have a transplant at that time. But because of an infection that I picked up at the diagnostic study at a Korean hospital, they had to remove half of my liver at that time. And so that kind of got rid of all the acute problems that were going on with me. And I stayed in the Air Force and worked another 8 years in the Air Force Nurse Corps on active duty before I was actually transplanted. I also am an educator. I work at University Transplant Center here in San Antonio. I am the patient educator for the adult side. And so I spend a lot of time working with recipients, with family members, with donors, and it's a very rewarding opportunity for me to give back. And so it's, again, something that when I retired from the Air Force because of my transplant, we moved back here to San Antonio and really wanted to be close to family. But I sought out an opportunity really to give back to the people that are experiencing the same kinds of things that I did at a level that maybe wasn't available at that particular time. Another thing that I do is I am the chair of the Patient Affairs Committee at the Organ Procurement and Transplantation Network, which is contracted out to the United Network for Organ Sharing, which is a group that we call UNOS. And in that capacity, I get to work on the national stage with peers and colleagues that are transplant patients. And by patients, I mean we are either candidates, recipients, donors, or family members of those three groups. And so we kind of clump everybody into that Patient Affairs Committee. But it gives me an opportunity really to work on the national stage and utilize some of the experiences that I've had as a transplant recipient and as a transplant professional. As I said, I was transplanted on October 31st. My disease is a slow-moving disease, and so I was actually diagnosed in 1998. And after I got through all the acute problems of that disease, then I went back on active duty. And the main problem with this is that the disease is slow-moving, and the problem that I had was itching. And the more you scratch yourself, the worse the itching gets. And so it was one of those things that really had a really big impact on my quality of life. And I think anybody who has an end-stage disease, whether it be for heart, for lungs, kidneys, liver, the big thing that people are going to describe is the impact on our quality of life. And the fact that we can't do the things that we want to do. If we're on a waiting list, our life is really consumed with waiting for that transplant. I received a transplant from a deceased donor. She was a 43-year-old mother of two. Her name is Cassie. And I was transplanted at Thomas Jefferson University in Philadelphia, not here in San Antonio, because that was where we were stationed at the time. But it's one of those kinds of things that your whole life is on hold while you are waiting for a transplant. Even with a living donor, I find that the people I'm dealing with that have living donors, a lot of stuff can happen. Somebody can get sick, somebody can get an acute illness or whatever, and it really kind of slows down the process. So until that transplant actually occurs, it's one of those things that really makes for a huge influence on our quality of life. People who are waiting for kidney transplants are on dialysis, either on peritoneal dialysis 6 days a week during the night, or they're on hemodialysis 3 times a week for cleansing their blood. And so those are big quality of life impacts. People who are waiting for lung transplants can't work off of any place further than 40 feet from an oxygen source. It just goes on and on and on, the quality of life impacts. And so we have been truly blessed, those of us who are recipients, to have gone through this process, really have been given the opportunity to really have a second birthday and to really look at options that we did not have available to us. And I think that anybody who's a recipient or anybody who's a family member of a recipient knows what a special thing organ transplantation is. And unfortunately, we do not have enough organs to go around in the United States. We probably do about 36,000 transplants in the United States each year, and we have close to 130,000 people waiting for transplant. And so my work with the Patient Affairs Committee at the Organ Procurement and Transplant Network is really to try to find opportunities to make organ transplantation available to more people. And obviously living donation has been a huge impact because we've been able to tap into a resource for what we call not national resource, but a national life source. And that's really what it is to transplant recipients and to their family members, that this is really a life source for us to be able to get back on our feet, really get out from underneath that quality of life impact that having an end-stage disease of any kind might have. So that's my story, and that's kind of what I'm bringing to this session today.
Thank you. I'm glad you brought up the idea of another birthday. At Transplants for Children, we are celebrating a second birthday for our executive director, David Davenport. Today is his birthday of his lung transplant. So shout out to David, and we love you and appreciate all that you do for us and for our community. So thank you for sharing that. I'd like to just switch, and I've got a couple of questions that I thought maybe Darnell and Rossi, we could start with the two of you. If we know that some people have a little bit anxiety and fear of talking about organ transplantation, and could you share with us maybe some insight you have on how your family overcame that anxiety, or Darnell, how you've worked with people in the past how they've dealt with that worry of talking about when they're not going to be here any longer, what that's like. So I'm going to turn it over. Rossi, do you have some thoughts on that?
Yeah, when we talked about it, my mother and I, my dad wasn't in town, so we hadn't had my dad's consent just yet. But my dad, he's a Mexican, macho, machismo, that kind of thought was running through my head. And surprisingly, he sat myself down, my sister, my brother, and my mom, and he said, what do you all, what do you think? What is your decision? And I specifically said, Dad, if I'm in that situation, please honor my wishes, and I said, and I think my sister would want the same thing. He was like, okay. And he went down the list, and I said, well, what is your take on it, Dad? Your take is very old fashioned compared to modern day, like things now are not the same they were 30 years ago. And he says, well, Regina had a heart, and she would give you the back of her shirt off her back if needed. And if she was able to say right now, I can save lives, then let's do it. So he went ahead and did it. There was no question about it. Now, immediate family, aunts and uncles were like, well, why is it taking so long? And At that point, it was just frustration, and I'm like, guys, yes, we're all hurting, but just think about it, somebody's going to be living a couple of days from now and have a whole totally new life. My husband is a medic, and at one point he was transporting organs. And he would tell me the stories, and he'd be like, hey, we're transporting this organ to go so and so and so, whatever. So when we were at that point, he was like, this is the side of the organ donation that I've never seen or I've never been around. And I think it impacted him as well. Like we're all for it, and I tell people, hey, organ donation is the best. It's amazing. The feeling to know that my sister gave life is one thing. What really helped my kids understand it and be more for it was when we got notice that somebody is now seeing because my sister's eyes for corneas. My son was like, so that means somebody's using my tia's eyes and looking, and I'm like, they're using your tia's eyes to read a book. They're using her eyes to watch TV that they've never been able to do. And now because of that, they're doing that. And he's like, I can't imagine my life without watching cartoons. And I said, well, now just think about it. This person lived their whole life basically without watching any kind of TV. And I think that brought a lot of perspective into his mind about organ donation. So, I mean, it's something very positive. Yes, it hurts, but it makes the feeling of losing your loved one. Know that there's other people out there that don't have to suffer and feel that grief by losing their loved one when somebody could have helped them. So we're happy about it.
Thank you. I love the way that he put it in what was important to him, cartoons.
Yes.
That's great.
He was only 6 years old at the time, and he didn't really understand.
No,
but
perfect.
he's learning little by little, it's a great opportunity for children to learn about others, and being involved with the foundation, they've seen things in a different perspective. You know, mom, why does this kid have this? Or mom, what's wrong with this kid? And I'm like, honey, you know, they're sick just like adults. Kids get sick too. And he says it, if the day comes where I gotta go and I'm little, you better give my stuff to somebody else who's gonna use it. So he's all for it.
That's sweet. Thank you. Darnell, you've seen this played out over and over.
From my experience, organ donation, particularly deceased organ donation, is not a topic that comes up regularly at the American dinner table. And I think the reason for that is because we are having to talk about our mortality, and that's not something that most people are comfortable talking about. And so when I talk to our folks at the Transplant Center, the focus I want them to have is that this is something that is really an act of love for my family. I'm telling them what I want to have done, and so that if something happens, that I have a catastrophic event and I'm now in a situation where I could be an organ donor, it's not the first time that my family has thought about this. They are not having to make a decision on my behalf about do I want to be an organ donor or not. If they know my wishes, then they are honoring those wishes. They're not making the decision anymore. They're honoring my wishes and carrying out those wishes when I cannot do that on my own behalf. I think we find that a lot of people find it a lot easier to have these discussions at the American dinner table if they have a family member or a friend who has experienced transplantation, because it brings that whole discussion closer to home. The other thing that I think really is important is the kinds of outreach things that people are seeing, particularly in schools and things where people go out and they talk about that. And so these young folks many times come home and they say, we had a talk today about organ donation, and it helps open up that discussion at the dinner table or places where people can really have an honest discussion about their beliefs about that. They can overcome some of the myths out there about being an organ donor. There are a lot of myths out there, and a lot of the outreach is really about breaking down some of those myths, some of those things that scare people from being an organ donor. But the other thing is that if you're on the national list, that really does makes a big statement. It's first person consent that you want to be an organ donor. And it does help kind of smooth out the discussion for a family who's dealing with, particularly with a deceased donor decision, of dealing with the loss of a loved one. Many times these people, our heroes, were going one direction in the morning, and by afternoon they were going 180 degrees in another direction. The family members are struggling with multiple things going through their minds, and to have had this discussion beforehand is why I really look at this as an act of love for our families, so that they're honoring my wish instead of trying to make a decision on my behalf.
So I guess that would be an outcome we could hope for from people who are watching this video, is they'll go back to their families and open up that discussion. Thank you. Thank you very much. I just want to switch gears a little bit. Debbie, if you could talk about sort of the timing of all of this, from when did you have your first conversation about becoming a living donor, and how did that kind of play out, just for timing?
Well, my sister's kidney function began failing probably 2 or 3 years before she had the surgery. And we talked about it briefly, you know, if I would be interested. And at the time, of course, I just quickly said, of course I would, without thinking much about it. I then did some research, and I was actually auditing transplants for children at the time. So I asked quite a few questions from your organization. And then I just prayed about it, and I knew it was the right thing to do. So when it came time for her to go or to have the surgery, I was prepared. And I knew that I was going to do it. I was more worried about the, you know, passing all the tissue tests and things like that. And, you know, is there going to be something that turns up as we're going through the process that is going to take me out of the process? And we were in somewhat of a hurry because my sister hadn't been on dialysis, and the doctors really didn't want to put her on dialysis because it weakens your body. So we basically talked about the time frame, and like I said, I think before, I had all my testing done really by the first week of April of 2018. And then we just picked the date, June 15th, more because I'm a small business owner, and I had a lot of May 28th deadlines. And so we determined that she could wait until then. And we had two choices anyway, the 5th of June, or I think it was the 5th of June or the 15th. It was a Wednesday or a Friday, the 15th. So it just worked out. And again, I didn't feel nervous until the night before. And then I had some butterflies, and again, just prayed for a little bit and felt fine. And the next day, it was a whirlwind. So, we were in at 5:30. I had not had a lot of medicine and had never been put up under before. So once they gave me that relaxation cocktail, I was out, and my sister was still talking. They rolled us through to say, our byes to the family. And my husband said my sister was talking, and I had drool coming out of my mouth. So, I don't remember anything after the cocktail. So
Yeah.
until about 1:30 p.m. So it was
funny
really,
that you
yeah.
said that everybody reacts so differently. So
Right.
Debbie, you bring up a real important point, is that the beautiful thing about living donation is that we know who the donor is, we know who the recipient is. And many times they're what we call preemptive, what you were describing in your case, where you can get those things done before a person has to go through the trauma of getting dialysis placement, going through dialysis. That is a beautiful, beautiful gift to people, because dialysis is very, very hard on the body. And so there are a lot of side effects to that. And so if you can do a preemptive thing with a living donor, that makes I think even more of a beautiful gift, in that you've given somebody an opportunity to stay off of dialysis in the case of a kidney transplant. That's a really big deal. The other problem is when any of us who have been waiting for a transplant, Travis maybe not remember this, but when you're waiting for a transplant, if you could give a person the date that they're going to be transplanted, we could pace ourselves if we're waiting for a deceased donor. You could pace yourself, but you don't have those dates with a deceased donor situation. And so your whole life, all the balls that you're juggling in your life are all up in the air at the same time, waiting for this to happen. And so I cannot overemphasize the beauty and how blessed people are that are coming forward as living donors to really make a huge, huge impact earlier in that end-stage disease process. So kudos to you.
Thank you.
Dawn, it might be a good switch to talk to you a little bit about that idea of the waiting, because you had to do that, and you were waiting with an infant. So maybe we could talk a little bit about how did you get support through that very difficult time?
Sure. Before I do that, I just want to tell Rossi thank you. Anytime I get the opportunity to tell a donor family thank you, it's an important thing for me to be able to do, because we have yet to find Travis's donor family. And so thank you very much for what you did for probably so many people. As far as Travis waiting, we had a lot of family support. We were very lucky. We had just relocated to Nashville, which was our hometown. We had family all around. And I think the important thing that we did was we learned to lean on that help. I think a lot of people are afraid to ask for help. They are unwilling to take it. They think it makes them look weak. And we kind of leaned into that. And it was so important, to know that we could step away on those Friday night. So that we could spend a night together. So my husband, we were very young. My husband was 23 and I was 22. when Travis was diagnosed. And we had been married about 3 years. And my husband was very wise for his age and said, you know, we have to have something for him to come home to. We have to hold each other up. We have to put our marriage in the front and center so that Travis has a happy home to come home to. And so we really did lean into the child life staff at the hospital. Our nurses who were there for us became like family. And it just really made a difference in those days, because those were the longest 3 months of our lives. We didn't know from day to day. They'd try a new medication to try to stall the need because he was so tiny. He was about 8 pounds. Probably got down to about 7. I finally stopped asking them what he was weighing because he was losing weight, and it was so scary. And so we just day to day had to rely on everybody that was available to us, the transplant coordinator. There were days that I just couldn't do it anymore. And we had a nurse, Yvonne, and she would come into my room and she would see my face and she would say, we're going to leave him with grandma for a few minutes and you're going to come with me. And we'd go for a walk and she'd pretty much tell me to get my stuff together because he needed me, and she'd shove me back in there. And those people and those moments were so important and impactful, even going forward, because the first year, especially after transplant, was so tentative. You know, it was weekly, sometimes bi-weekly doctor's appointments, blood draws. And I had gone back to work teaching school. My husband was working full time, so we had to rely on grandparents. And like I said, even great grandparents would come to town and take him for doctor's appointments or watch him while we were at work, because he couldn't be in daycare because he was immunosuppressed. So we had to do that. So yeah, I think it really is just important to encourage people. I try to encourage them when they're going through things that are hard. Lean into those people who offer help, because they really do want to help. And sometimes you have to be very specific about what help you need. But if you'll speak up, there's almost always someone there who can step in and fill that void for you. And it's not a sign of weakness, it's actually a sign of strength, because you need to be strong for your child that is going through this, or through, even if it was a spouse or a parent. Your strength comes from anywhere that you can find it. And if that means getting help from outside of yourself, then by all means, go for it.
Yeah, I want to add, go ahead, Rossi.
That's definitely true, because the night before my sister went to operation, I remember the nurse coming in, and it's like they know that you're hurting, they know that you're frustrated, and it's the words that they use, even though you don't ask for the help or the support, it's the way they give it to you. You know, he came out and he said, you know, guys, y'all need to go home. You need to get some rest. It's going to be a long journey these next couple of days for you all. He says, just know that her soul's already in heaven. And at that moment, when he said that to me, I was like, you know, he's right. Like, she's not here spiritually, but her body's here. You know, because we were by her side all day long. You know, we didn't leave her side. You know, we wanted to be there in case anything happened, you know, just by chance. But when he said those words, it's like, it was comforting knowing that I had to let go. I had to let go so my sister could continue doing what she was put on her to do. And I was to give back. And those words at that moment, you know, made me feel like everything was going to be okay. And I totally get what Dawn was saying.
I think that kind of echoes to just the time that we're in right now as a world impacted by COVID-19, that we need to ask for help when we need it, and acknowledge the people who are put in our path, and the nurses and the support staff. We were very blessed when our son Zachary was getting ready for his kidney transplant. He's a recipient from his dad, and we had the most wonderful mentor and coach to support him, and that is Mr. Darnell Wan. Was our transplant really coach and angel and saint all wrapped up in one.
That's awesome.
Yeah, everybody should have a good team of support, right?
Yes.
Absolutely.
So thank you. I think those are all really important pieces of this journey. I wanted to kind of end the discussion. Is there what else do we want the general public to know? People who are tuning into this video interview, if we could leave them with just one thought, what would that be?
I would just say put yourself in their shoes and think about what they're going through, and they're wanting, a transplant. There's those patients that are really wanting it so they can go on with their life and get better and live normal life. Put yourself in their shoes and think about what you would want and how you would feel, and then you would make your decision at that point. I know a lot of people are very against it, but then there's people that, they think about that. They're like, you're right. Like, what if the day comes that I need it? I'm going to be looking for them just like so-and-so are looking for a recipient or a donor or whatnot. So I think that they need to do that and just think about the outcome part.
Thank you. Debbie, any thoughts on that?
I have two thoughts. I think it was a lot easier than I would have thought initially. The process took a little time away from work, but really I was back to work by 3 weeks after the surgery. And again, I was out of the hospital within 26 hours, 27 hours. So I think from that perspective, it's a lot easier than people think. But the other thing is, when we were going through the process, typically a living donor is more beneficial as far as kidneys than somebody who's or not beneficial, but lasts longer than a person who is deceased. And again, the amount of time, the amount of uncomfortableness is so minimal to seeing your sister or maybe somebody else prosper after the surgery. So I would do it again in a heartbeat.
Thank you. Dawn, any final thoughts?
I think the point that I'd like to make is just to help people understand that you're not just saving a life, but you are giving life in just a completely different way. I think one thing that we encountered as Travis grew up is we didn't present him as this kid that had had a heart transplant. We presented him as Travis. And so often people wouldn't find out until we were having his heart day party. We always had a celebration on his heart day. And there were no gifts because he was taught that the heart was his gift, but we were celebrating that gift and, celebrating that family that had given him the gift. But we would invite kids over and have cake and play and do that sort of thing. And sometimes people would find out the very first time about his heart because of that heart party. And so people would start asking questions, and they were always so surprised that he was so normal and so healthy. And I think sometimes people have a perception that even after a transplant, people are still sick. And most of the time, that's not the case. And, they do have issues, some of them that they have to deal with, and they do need monitoring. But it gives life. It completely gives life. And I just think that's an important message that people need to know.
Thank you. Darnell, any thoughts?
When we were preparing for this panel, they asked us to think about one word that described transplant experience, each of our transplant experiences. And the word that I picked up was renewed. And the reason I picked that is that just like Dawn was saying, our life is not, it's changed, but it's not something that is separate. My post-transplant life is not separate from who I am and the person that I was before that. And so what I did was, through transplantation, I really exchanged a chronic illness or disease for a chronic condition. And so every day, my transplant does not run my life, and very similar to Travis probably, if I didn't tell you I was a transplant recipient, nobody would know that. And that is a successful transplant. And so those are the kinds of things that, as we move through our life, we celebrate that every day when I take my medications at 8 o'clock in the morning and 8 o'clock at night. I say, here's to you, Cassie. This is the person who really renewed me and did not recreate me. I'm not a whole new person, but it's something that every day I honor her memory by making sure that I keep myself as healthy as I can. I follow my medication and lifestyle regimen to the T. And that's all I can do for her at this point, somebody who really gave me such a tremendous gift.
Well, and I would like to say thank you to all of you for the tremendous gift of sharing your experience with everybody who's tuning in and listening. Another shout out to Travis, who is our video coordinator. And Travis, can you just give a quick day? What day was your heart celebration?
It was on March 28th.
March 28th. So another celebration of just this amazing journey that we all are on. And it's been my honor to be with you this evening. Thank you all so much again for sharing the story and for being a part of our Pediatric Transplant Week. I'm going to end with just a couple of pieces of information for you. There are more than 156 million Americans currently registered as organ donors. And you can join that list by going to the website registerme.org to learn more about organ donation. I want you to feel free to contact us at Transplants for Children, or there's donatelife.net. That's another great resource for you. And we believe that the more people know about organ donation and the more willing that they are to discuss it, the better we will be as a community able to support those who are in need. So thank you all so much, and thank you to Transplants for Children for your commitment to assisting children and families throughout this journey and some of the challenges that we face. So everyone, have a wonderful evening. Thank you all again to our participants, and we'll see you soon.
Thank you.
Thank you.